You are now listening to Surroundor MD.
Today I was reminded of how important it is to follow up on your patients. The major reason that I follow my patients is because it directly benefits me as a physician, as a proceduralist. All right, so case in point today, did a procedure Friday, did a fistulogram, and it was pretty complicated. Fistula had been down for a little while, and there was a lot of stenoses. Namely, there was segmental stenosis centrally, and there was a brachiocephalic venous stent, which was had in-stent restenosis. So placed a new stent within that stent, plastied some other veins. Also, there was a tight anastomotic stenosis just distal of the arterial inflow, and plastied that 6 millimeters. Long case, difficult case, went late. Closed the fistula sites. Wasn't sure if I felt a thrill at the end, but basically there was nothing else we could do. Monday morning, today, I checked in, went to see, patient was there, in-house. So I went up and went to go see him. I want to go see, how's that fistula doing? Is there a thrill? And I was actually pleasantly surprised to find out that the patient was doing well and that there was a thrill. And it really justified that use of resources, that lengthy procedure that we went through on Friday. And I kind of felt vindicated. I really felt, hey, wow, this procedure we did using a decent amount of inventory actually worked pretty well. And he has a thrill. And I'm pretty sure they're going to be able to successfully use that for dialysis. And without me going up to see him, I would never have known that. And that's really what it comes down to. As a proceduralist, you're never going to know the true value of your procedures if you're not following up these patients in some way. It's a great thing to do is to capture them while they're in the hospital, capture that post-procedural visit in the hospital. You want to have the patients come back to see you in some sort of office-based setting. Now, some practices, this just isn't done. Some practices you can do it, but it's not formal. But formal, informal, whatever way you have to do it, try to get those patients back in to see them and see how they're doing. Other thing I realized today is what the patient really wants from you as a physician. And it's not necessarily always the procedure. It's a lot of the time what the patient really wants is just a little bit of your time. They just want a little bit of your time spent in consultation, a little bit of education, a little bit of discussion, a little bit of a release on their end. They just want to release some information onto you and just have you think about it. It sort of gets it off of their chest and puts it onto your plate, and you're allowed to think about it and make some general recommendations or just say some comments or maybe just be there as somebody to listen to that patient. That's a lot of what we do. I think it's one of the most important things that we do. Doesn't create any RVUs, but just having that patient talk to you, I think it's really therapeutic for the patient. A lot of the patients in interventional radiology are unfortunately end stage. We treat a lot of times liver cancers that are progressed or cancers of the colon or other organ tumors that have progressed. And oftentimes we're involved in those types of patients. A lot of times we're dealing with palliative cases. We're just trying to make patients feel a little bit less pain or a little bit less symptoms during the end of life. I think at that time, a lot of times what we can be is we can just be a physician that is there with the patient near the end of life. And we can be there as an educated, interesting person for them to talk to. And I'll tell you, I've learned a lot from patients. I've learned a lot from these patients that are in their 80s and 90s that have a lot of life experience and they want to talk. They want to discuss something. They're there sitting in your office and they just want to engage with a physician. Whether it's about their symptoms or their home life, they want to engage and talk to somebody. You're there, you're available. And, if it can lead to a procedure which is of mutual benefit, great. If it doesn't, that's fine too. But certainly every time I interact with a patient, I learn something, and I think certainly patients get a lot out of it too. So, those are some thoughts and themes from the day. Another day of private practice here in Southern California. Struggle RMD.